Hi there, I'm Dr. Erin Katribe, the Director of National Veterinary Programs for Best Friends, and today let's dig into medical care for community cats. So, what are we doing to treat cats in trap-neuter-return and return-to-field programs? First, let's take a look at preventive care. So, as a minimum, these are the things that we want to do for every cat in our program. It's going to be a modified live FERCP vaccine, a rabies vaccine, and then sterilization, and of course, an ear tip to indicate their spay-neuter status. Ideally, if we have the resources to do it, we can apply a topical parasiticide. So topical selamectin is a great option. Not only is it going to treat our fleas, but it's also going to treat ear mites and mange. There are cheap options, and so the generics, and it is no mistake that I actually have Dog Revolution on this slide because you can actually put the Dog Revolution in a multi-dose vial and dose it out by volume for cats. And so this is a great way to reduce cost. Not generally recommended, maybe an option, may be appropriate in some situations, but microchips. So microchips are usually just not a good use of resources because of their expense. But there may be some circumstances where we need it to comply with ordinances, or if we need to show some data around the program. For example, cats that are getting brought into the shelter and need to be identified. If they end up at the shelter again, do we have a reason where we really want to use this microchip to identify where they came from? What about combo testing? This was intentionally left off. So this is an excerpt from the 2020 AAFP Feline Retrovirus Testing and Management Guidelines. And so AAFP notes that the success of TNR programs hinges on deploying adequate financial and personnel resources to sterilize cats faster than they can reproduce. And so these AAFP guidelines and best practices for TNR programs say no, we should actually not be combo testing. In fact, sterilizing these cats reduces the two most important modes of transmission for these diseases. It's queen to kitten for feline leukemia and fighting among males for both leukemia and FIV. Because the population control for cats requires this commitment to sterilizing the largest number of cats possible, it's recommended that we devote as many resources as we can to maximize the number of cats that are sterilized. And so that is why we do not recommend FELV, FIV testing as part of TNR and return to field programs. And so you can see right here, even in those guidelines for TNR cats, FELV, FIV testing is not recommended. All right, so what about management of common medical conditions? How do we manage these in these cats, and how does that impact eligibility for return? The first thing I want to say is it's really important to be ready to pivot. So for these cats that are coming in, if they're unsocialized, then we essentially have one chance. And so we need to be ready to address surprises. If a cat shows up in a trap and looks like this, then I need to be ready to pivot and to address that situation. What I don't want to do is sedate this cat just to examine it or sedate to do diagnostics. We want to try to do everything all at once under one anesthetic episode. That's going to be the most efficient and it's going to be the safest thing for this cat. But that means I do have to be ready to address surprises. First, let's talk about some general considerations for treatment. So the first question we should always ask ourselves is, should we or do we need to treat at all? Is conservative management an option? Is this something where the cat might actually get better on its own? And so the most important thing we can do is sterilize it and return it, particularly for diseases that are mediated by stress. Staying in the shelter for treatment may actually make that condition worse, not to mention if it's an unsocialized cat, the welfare of that cat is going to suffer while it's in the shelter. Other considerations, length of time to treat. If we have multiple options, is there one that will require less time and we can get that cat back out faster? Socialization status. So are we able to medicate that cat based on that socialization status? Is the socialization status going to affect our ability to care for this cat in a foster home or in the shelter? If the cat is truly unsocialized, then we need to consider that that's not going to be humane for that cat. Do we have feline-friendly medication options? So single injection long-acting antibiotics are a fantastic example that we only have to give once versus trying to orally medicate a cat day after day after day. And then caretakers. Do we have a caretaker identified that can monitor that cat undergoing treatment if we put it back out, if we're not sure how the cat's going to do? Sometimes there's caretakers that actually can handle these cats. And so maybe getting in touch with that caretaker and seeing, maybe we can't medicate the cat in the shelter, but that caretaker actually thinks they can. Other considerations, it's thinking about balancing priorities. And what I mean by this is, potentially there's a treatment available, but it may be really resource intensive. And so when I think about the limited resources that we may have in our TNR and RTF programs, does it make sense to focus a lot of those resources at the expense of potentially providing care for a whole large number of other cats? And so this goes back to that, similar to the feline leukemia FIV testing, right? I'm balancing those priorities. Taking into consideration one individual cat versus the resources that could potentially sterilize and vaccinate a whole ton of other cats. So it's also thinking about individual and population health, right? So by doing something for that individual, do we potentially sacrifice what we could be doing for the population? Or maybe what we're doing for that individual does matter for the rest of the population if it's something like infectious disease. So vaccination is a great example here. It's why we do want to invest in vaccinating these cats. Think about that use of resources. And then think about incremental care strategies. So when we say incremental care, what we mean by this, it's patient-centered and experience-based medicine that focuses on problem solving to get the best outcomes in the context of limited resources, right? And so we can apply these incremental care strategies to our TNR and RTF programs. This again goes back to for community cat management, the best thing that we can do all around is reduce feline overpopulation. And so that means conserving those resources to spay or neuter as many as possible. Diagnostics. Question we should always ask is the results of testing going to change what we do? And in most cases, the answer is no. If it's a relatively healthy cat or even an unthrifty cat, but a cat that's doing okay, blood work, as an example, isn't going to change anything. I still need to spay and neuter this cat, and we have our opportunity to do that today. Does this cat seem dehydrated? Okay, well, let's give him some fluids while he's out. But if he has kidney or liver disease, does it matter? I potentially won't be able to treat him for either one of those things, but he's not at a point where I would make a life-ending decision at this point either, right? So is that test going to change what we do? And in that situation, probably not. So lastly, consolidate treatment. So do everything you can while you have them anesthetized. So all of their vaccines, their spay neuter, their other surgery, we're going to do everything at once. In the event that we do need to do some diagnostics, we're going to do it all at the same time. Okay, so let's dig into some specific conditions. So first, we have upper respiratory tract disease. Remember, the number one risk factor for shelter cats and respiratory disease is their time in the shelter. This is a disease of stress. And so the vast majority of cases, whether they came in with URI or they've acquired it while they're in the shelter, I'm going to spay and neuter them and release them. And in fact, I'm going to prioritize the cats with URI to get spayed or neutered first. What I am not going to do is hang on to them in the shelter. Hanging on to them is likely going to just make them worse. So I prioritize them. I try to get these cats out faster even than the healthy cats. So spay and neuter them and put them back out. I do take some precautions, right? I will often intubate these cats at surgery if I wasn't going to do that already, and I will try to clean them up while they're under. Question that always comes up is antibiotics, particularly cefovecin, which you may know is convenient. And I will tell you, this is not a great antibiotic for upper respiratory disease. It doesn't catch our primary bacteria, and most of these are viral anyway. So the only thing this is going to help with is some secondary infections. And so by and large, I do not use this unless it is a cat that just is totally crusted over with severe bacterial infection. Then that's the only situation where convenient might actually help. And so I avoid this in the vast majority of cases. Wounds. So let's talk about that. So certainly while they're under anesthesia, we can do some basic wound care. This is a situation where cefovecin is a great option. It will help treat those infections or prevent infection. Depending on the wound, it may be that we decide to primarily close that wound, or cats are great at healing. And so many wounds, if we just clean them up and sterilize that cat, put them back out, they will heal on their own. Traumas. So sometimes we get these cats in for surgery and we find out that they have a trauma. So tail injuries are a really common one, so potentially traction injuries. And so these will just do that tail amputation at the time of surgery. And so you can see an example of that here. And then what about fractures or like really severe wounds like degloving injuries? And so these are cats where amputation might be an option. If it's an older wound, if this cat has not been using this leg for a long time, I go ahead and amputate, and they're eligible to go back out tomorrow. And the reason for that is, again, they've not been using this leg for a long time. Let's just take away the source of that pain or that infection. For cats where that injury is maybe more recent or where they may not have already compensated, we can think about other options. So if they're socialized, put them on an adoption pathway. Again, if it's chronic, then go ahead and release them. If we are still a little bit concerned and want them a little more watched, maybe we have a caretaker that's willing to monitor them, or we can relocate them as part of a working cat program. This is an example. So this was a cat with a really severe wound. And so he had an amputation done and he was actually released. Here are some other examples of trauma that we might see. So I don't think twice about enucleating these end-stage eyes and then releasing these cats the next day. We typically will do an intradermal closure, so there's no sutures that need to come out. Jaw degloving is also a common injury in some of these cats, and you can try to repair those, suture those as best we can, anchor it around the teeth and hope for the best. I see so many that are previous injuries that have healed on their own. And the one thing I would call out is be aware if it looks like it is a recent injury, if it's acute, then do consider that these cats might have been exposed to head trauma. And so keep that in mind regarding your anesthetic time frame. And this really goes for all injuries. This might be the one situation where I say maybe pause and wait a day or two before we anesthetize them, balancing that risk of recent trauma, potentially head injury, with the need to get them back out as quickly as possible. What are some of the common skin conditions that we encounter? So mange is something we'll see in that cat in that picture with the skin scrape, but this is a really classic presentation when you see that, just that significant crusting on their ears. And so selamectin as well as Advantage Multi are great options. Occasionally, if I have really severe cases, these cats can even be systemically ill, I will actually hang on to them to do a repeat dose. But for the vast majority of them, including the cat in this picture, it's just treating and sending them back out. Ringworm. So ringworm is actually self-limiting. Remember, ringworm is a skin infection. It's a fungal infection, not a worm at all. And it is self-limiting in the vast majority of cats. And so I go ahead and spay and neuter these cats and then just release them. We do need to pay attention to our biosecurity, and this is so that we don't transmit ringworm to other healthy cats in our surgery area. So be aware, right, and take some precautions. Do them last, potentially, so we don't spread disease. But these are cats also that I want to get back out and into their community. Other parasites that we might see, so ear mites, again, selamectin is a great option, or there are formulas out there for diluting ivermectin. Selamectin, also great for lice. I usually keep some injectable praziquantel around if we have tapeworms. Now, tapeworms typically do not cause a lot of problems. They bother us more than they bother the cats, but it's not wrong to go ahead and treat them. And then again, for other intestinal parasites, selamectin will treat a lot of those, or we can potentially try to do pyrantel in their food after surgery. What about cats with dental disease? And so if I have cats come through surgery that have mild to moderate disease, we essentially do nothing with them. We sterilize them, we put them back out. If I have cats that have severe disease, one question is, what is our clinic or our shelter's bandwidth to address, right? Do we have dental resources? Could we even do a dental if we wanted to? And potentially, if we can't, I look at that cat's overall condition. Is that cat otherwise thriving despite its dental disease? If it is, I go ahead and release that cat. If the cat's not thriving, then the big question that arises is there other contributing disease? So does this cat it's an older cat, presumably, does it have chronic kidney disease as well? And so even if I treat its dental disease, is it going to be releasable? And the reality is we just don't know until after we pursue it, and that's a lot of resources. And so when I have cats that come in poor body condition with severe dental disease, again, that's the question I ask. If I see these cats and they're not in good shape, I have absolutely made some euthanasia decisions on cats like this. I have other situations where if we have a caretaker identified, we may talk to that person and maybe it's a cat they can really keep an eye on. And so perhaps we release with instructions to monitor them and retrap if needed. And I think it's important for us to have a conversation about euthanasia decisions. And so it's really thinking about if we have these cats that come in and they're severely debilitated, or if there are emergent cases beyond the scope of what we can treat or what we can reasonably manage, for example, a cat in respiratory distress, or if there are cases that carry a poor prognosis, then absolutely thinking about euthanasia, like that could be the humane thing to do. In situations where maybe we have a condition that requires a really long holding period and there's no alternative option and the cat is truly unsocialized, we have to ask ourselves, is that in the best welfare of that cat, depending on that socialization status? And then lastly, if one is available to consult, I do check in with caretakers and finders. The cat may have a different socialization level for that person than they are demonstrating in the shelter, and that person may have some ability to actually treat them. I also do just think it's a courtesy if we are going to make some of those euthanasia decisions to have that conversation with them first. Even though we don't consider them owners in the traditional sense, it is the nice thing to do because oftentimes they care deeply about these cats. All right, so let's wrap up. Remember, should be the default pathway for cats that come into the shelter as strays. For our owned cats, this is the most likely way they'll get reunited with their people, and for true community cats, they're often thriving. So let's get them back to their community home. We want to treat and return them as quickly as possible. For the vast majority of these cats, keeping them in the shelter for treatment is just going to make things worse, particularly for those diseases that are mediated by stress. And again, our RTF should be our default pathway for those cats. For cats with medical, our goal is to choose the treatment option that will get them back out of the shelter the fastest, right? The longer they stay, the more likely they are to get sick and to suffer poor welfare from the stress of the shelter. So the best thing for both individual cats and the best thing for life saving is to get them back out into their home and their community. There are a ton of resources out there online I wanted to share. So our community cat handbook is available at network.bestfriends.org. So check that out. And then we have some resources from our National Shelter Medicine team. So you can reach out to us for help with anything community cat related or otherwise using that QR code or email us at sheltermedicine@bestfriends.org. And if you need sample medical protocols, including a return to field medical guidelines document, check out our medical protocol library with that second QR code.